Hello, 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 everyone. Hello, hello. Hi. Welcome. Happy Friday. Hi, I'm Dr. Mercy Ajonwe, and welcome to another Q&A with Dr. Mercy. I'm so happy you guys are here. Let me look at the comment section. Hi, Bernice Mason. How are you? Happy Friday. Hi, Janetta Johnson. Hello from Atlanta. I hope everyone can see me. If you guys can hear me, feel free to write on the comment section. We are getting started. So, exactly. What are we going to talk? Oh, hi. Hi, Miss Williams. How are you? So, what are we going to talk about today? Well, today we're going to talk about COVID monoclonal antibodies. Now, you guys have probably been hearing about this treatment for some time, and it's just now people are starting to get this treatment. So, because of a case that I heard about this week and I actually was involved in, I decided to kind of talk more about what the monoclonal antibodies are and how they help with COVID and who can get it and what are the adverse effects and things of that nature. Feel free if you guys have any questions about monoclonal antibodies or just have any questions about COVID, feel free to write them down on the comment section and we can discuss it. So let's start. So as we talk about COVID and monoclonal antibodies, we talk about these two forms of treatment that are pretty much used as an outpatient for patients who do get COVID. Okay. So when I say as an outpatient, what I mean is this medication is used as a treatment for those who may not require hospitalization or may not have to be treated in the hospital. They're not sick enough to be treated in the hospital, but they did have the COVID infection. And so, a lot of times when certain people get infected with COVID, the providers are saying, well, let's treat you with COVID monoclonal antibodies. So, the two that are in the market are noted below. Where's my noted below? And they're such a long name and really hard to pronounce it. I just wanted to write it below so you guys can see it. These are the two that usually, if your providers are prescribing it for you, they choose one of the two. And usually what it is you get the prescription and you are referred to an infusion center. And an infusion center is just pretty much a clinic where you go in and they infuse these antibodies into your system through an IV. Okay. Lasts anywhere from 1 to 2 hours or so. And then you go home. Now, there's not everybody gets these antibodies, and so before we talk about who are the ones that get it, let's dive into the science. So I have here with this paper, and I'm trying my hardest to show it. So this is how. Okay, let's pretend that right here, and I'm trying my hardest. Right here in the center is the actual virus itself. You can see this. I hope you can. Right. So surrounding the actual virus, you have these, it looks like Y forms that are green, right? And so with the COVID monoclonal antibodies, they would really be those green Y that you're seeing right here, right? So when you get infused by the antibodies and you actually have the COVID virus in you, what happens is these viruses neutralize, meaning they attack the virus by adhering to it. So they will see the virus, and it's almost like a puzzle. Okay, they have a certain structure on them that fits the outside of the COVID virus itself, and they just clip onto it. When they clip onto it like that, what they're doing is they're neutralizing. And when I say neutralizing, they're making the virus less active so they don't actually affect your body. So if they surround the virus like it's shown here, what is happening is now the virus cannot adhere or cannot stick on to your cells, and they cannot now infect your cells. And once they're stopped from infecting your cells, guess what? They're stopped from actually producing further viruses in your system and causing this overabundance of viruses that wreak havoc in your system. So these antibodies are really important because they help to, like I said, neutralize the virus so it's not bothersome to your system. Now, studies have shown that people who require the antibodies are usually those who have a high risk of having the severe form of COVID. So if you're young, if you've had the vaccination, likely you don't have the high risk compared to some of the people noted below. So if you are over 65, you're pregnant, you're diabetic, you're obese, you have kidney disease or any chronic form of illness, maybe have a neurodevelopmental disorder, so meaning you have a neurologic birth defect such as cerebral palsy, or you have sickle cell disease, or just severe illness or chronic lung disease, you are at high risk. So, and especially if you haven't vaccinated yourself, okay? So if you do get diagnosed with COVID and you go see a practitioner, they may recommend that you get this antibodies. And why? Because of what I showed, it can help neutralize the virus. And not only that, studies have shown that those that get this antibody, they tend to not the rates of them going to the hospital is lower compared to had they not gotten the antibodies, the monoclonal antibodies. So for those who are high risk of developing severe form of COVID, it's a good thing to consider. So um, the couple things about the antibodies, right? Not only are they restricted to certain populations as noted below, but also to how long you've had COVID. So they recommend those who have had COVID within a 7 to 10 day period of time, you're the ones that are eligible. After 10 days, you're no longer eligible. So if you come into the clinic, the first thing they're going to ask you is, when did you start having the symptoms? From there, they will not only see if you are within the group that I noted below, but they'll also see how long has it been since your initial onset. If it's been more than 7 to 10 days, they may say, no, you're not eligible. So what is my take home point in that? Well, the take home point is, if you are positive and you start noticing symptoms progressing, go see your doctor and let them decide if this type of monoclonal antibody treatment is for you. Okay. So I wanted to just kind of talk about that. And another thing that people may talk about, they may say, okay, it's a treatment, so obviously there may be some risk associated with it. And if you're thinking that, good way of thinking. The only risk that they've seen, and they say that it's very uncommon and mild, but some certain reactions that you can get with it, you can get with any injection. You can get fevers, chills, you can get some tenderness at the injection site. For those who maybe, you can have some people may be allergic to it. So if you are allergic to it, you would have the classic allergies such as hives, things of that nature. And you can get nausea. But again, I want to stress that it's very uncommon to have these symptoms, and usually majority of people tolerate it very well. So this is just like a treatment for people who are being treated outside the hospital for COVID. And I would also still recommend just along with this, just the home remedies that we've been talking about in the past, which is vitamin C's, the zincs. I would recommend you taking the vitamin D, staying well hydrated, and also if you are developing shortness of breath, you definitely should come into the hospital. If you're developing chest pain, you should go into the hospital. But if they deem that you're safe, one of the things that you want to do is you want to monitor your oxygen levels, right? So you would go and buy oximeter, which is a little machine that you can put on your finger that will look at your oxygen levels. You would also, just like I said, stay hydrated, check your temperatures, those type of things to make sure that you are supporting yourself through this illness. Okay. So in the nutshell, COVID monoclonal antibodies, or monoclonal antibodies that are used for COVID, is one of those treatments that I've been seeing ordered quite frequently for those who have mild to maybe moderate COVID levels of severity that don't necessarily need to be in the hospital, but because of their high risk situation, meaning because of their conditions, underlying conditions, they're at high risk to have a severe form of COVID. So this is one of the treatments that we're just using to kind of prevent them from actually developing a severe case of COVID. And so it's definitely something that I would consider as someone excuse me, let me say that again. It's definitely something that I would consider if I was in that situation. Obviously, you want to talk to your doctor before ultimately making that final decision, but I hope our discussion today has given you a little bit of an enlightening of it, of these treatments. So, if you guys have any questions, just let me know, and we can continue on. Let me see. So, so again, uh, let me talk more about, the treatments. Let me talk more about the treatments in terms of COVID home remedies that I've always told people who are suffering for COVID but are at home. Not only did I say the supplements, a lot of times when people are sick with COVID, they want to be laying down in bed. And I always tell my patients that that is one of the worst things you could do. You want to be active and stay active as much as you can. I know COVID can be a very tiring um, infection and disease, but the whole goal is by you staying active. It may seem counterintuitive, but it actually helps to fight the disease itself. Also, if you start having the cough, a lot of times that's an indicator that the COVID has actually reached your lungs. So, one way to prevent it from further wreaking havoc in your lungs is by taking breathing exercises. I always tell my patients that you want to do it maybe 3 or 4 times. You want to do it maybe 3 or 4 times a day, and you just take, I say, 10 deep breaths in and out. You do it 10 times, just again to open up your lungs so that your lungs are staying active. The whole thing with COVID is it produces a lot of mucousy secretions, especially in the lower parts of your lungs. And as it continues to do that, it starts making the lungs stiff so that they're not taking as much deep air as they should. And so the whole goal when you're taking those deep breaths in and out, you're keeping those the airways open so that mucus secretions that are happening cannot affect your lungs at the level in which it would if you were just kind of laying down and not doing much. So always doing breathing exercises when you can think about it during the day greatly helps. Another tip that I've also told people, especially when you start coughing and you start feeling short of breath, but when you look at your oxygen level, it's really normal. And that is to if you are sleeping, to consider sleeping in different positions. So sometimes you would sleep on your side, or people have noticed that when you sleep on your stomach, that again, it helps open certain sections of your lungs so that you're breathing in more oxygen. Okay. When you're coughing, make sure when you cough, have treatment for that. In the hospital, we use Robitussin, but whatever works for you, would be best. Hydrate yourself, like I said, hydrate yourself, and stay active. So, does anybody have any questions that I could answer for you in terms of COVID, in terms of monoclonal antibodies? Let me know. Let me see if I got any questions. Hi, Dana, how are you? Hi, Jacqueline, how are you doing? All right. Okay. So that is it when it comes to COVID. If you have any questions, definitely let me know. Um, Typically, after 10 to 14 days of quarantine, a lot of times that's when you can get out of quarantine. Um, and, always be, always be under the guidance of your doctor. Thank you so much, Cherokee, for that comment. Thank you so much. I really appreciate it. And a side note to that, the medical team, they are hardworking. Anybody who's in the medical field, anybody who's exposed to COVID, not only in the medical field, I mean, from the janitors, from the security guards in the hospital, even outside of the hospital, if you're exposed to COVID, the EMS, EMTs, they are especially in the beginning when we first started experiencing COVID and not knowing what it really was. I mean, huh, it was something. It was definitely something that not only was demanding physically, but it was demanding mentally. But all all the people in the hospital, they have a really good, what I learned from COVID is that during this hard time, everybody comes together and we're a team. And so this has really brought a lot of not only camaraderie, but everybody wants success. They want people to get out of this COVID. And so you see these teams working hard, even tirelessly, just to make sure that these patients are surviving. Typically, nurses, they would be working 3 days at a time, but now they're working 6 or 7 days, and they're tired, but they refuse to relent because they know that these patients need their help. So I just thank everyone who's been a part of this journey, and I pray as soon that we can get out of this pandemic. Oh, yes, this will be available on the Facebook Live as well as LinkedIn. On the BWE platform. And so if you want to replay it, feel free to. And if you want to share it, feel free to as well. So I'm just thankful to be a part of this platform and helping you guys learn more information, not only from my perspective, but some give you some ideas of things that maybe you can look up or maybe you can ask your doctor in regards to your treatment or the treatment of your loved ones. That's what this is whole about. And before I close, I do want to talk about the platform that I'm in, the BWE platform. I don't know if any of you guys have gone to the BWE network. Uh, you're hearing me live and giving you medical advice and information, but there are a slew of experts within the network, from mental health, from mental health to spiritual videos, through documentaries. And so, I mean, there's a slew of just wealth of knowledge within the BWE network. So if you have time, just go to www.bwenetwork.com and just enjoy yourself and enjoy the videos and enjoy all this wealth of information that we've already composed from the different experts within the network. So make sure, if you have not seen this website, the bwnetwork.com, make sure you do go and to just navigate the different videos. So I just wanted to, like I said, hop on and just talk about the monoclonal antibodies this week. Next week it will be Medicine for the People with Dr. Susan. And then the week after that, it'll be me again. Until next time, You guys have a wonderful week and stay safe. Bye.